So hopefully everything is clear related to this particular topic. Next is just have the sample question before we talk about this particular topic, that which of the following bone infection does not have abscess, or which of the following bone infection it starts with the diaphyseal involvement, because majority of the bone infection they starts with the metaphyseal involvement, but this is one such infection where the diaphyseal involvement is the primary involvement. So let's have a discussion on Gary's sclerosing osteomyelitis. Now, as the name indicates, sclerosing osteomyelitis, point number one, that there is no abscess formation in this kind of the, it is a kind of the chronic osteomyelitis where there is no abscess formation. All right. So it is a type of chronic osteomyelitis, a long-standing infection of the bone where there is no abscess formation. But one more thing is common is, and that is the primary diaphyseal involvement. So there is a diaphyseal involvement which can happen in these kind of the infections. And point number four, finally, that this is the kind of the osteomyelitis where only a sequestrum is present, which is not surrounded by the abscess. All right. So there will be a sclerotic lesion, the presence of a sclerotic lesion. As the treatment is guided for this particular condition, or if you ask for the management that how this condition is going to be treated, the treatment is always surgical. Now, this is the kind of the condition, just expect what will happen in a patient who is suffering from Gary's sclerosing osteomyelitis. The patient will be having a vague pain, a long-standing vague pain in the particular limb where the bone is affected. But diagnosis is delayed because you don't get any lesion, or the possibility of the presence of the sequestrum could be delayed for its identification. Most of the time, the surgeon might reveal, or there could be a possibility of a misdiagnosis that, everything is fine. But because of the persistent pain due to this kind of an infection, it is mandatory to remove this sequestrum. That means the sclerotic region of the bone has to be surgically removed. So that is the management. So it is always surgical. Treatment is always surgical. All right. So this is how you have to remember everything related to this particular type of the osteomyelitis. So what we have discussed, 4 different types of the osteomyelitis. First one was the acute. Second is the chronic. We have all discussed about the pathophysiological mechanisms in the chronic osteomyelitis. The third one is the Brody abscess, and the fourth one is Gary sclerosing osteomyelitis. Now, one thing which is common in all these 4 types of the infections, that is that there is no direct involvement of the joint. Now, what we are about to talk is the involvement of the joint because of these infections, and that is coined as arthritis. That means septic arthritis. So the next condition that we are going to talk about is the septic arthritis. Now, first of all, let's decode this topic name itself, or let's decode this heading itself, that what is septic arthritis. Septic, as the name indicates, it is infective pathology. So something which we are dealing with the infection. So septic means infective. Now let's talk about arthritis. Arth is the word which is used for joints, and itis is the inflammatory pathology. That means the outcome of any inflammatory pathology is arthritis. Now, the problem with this heading is that it is not the outcome of the joint infection. Just try to understand. For example, if I say that this was the joint and this joint got infected, there was a collection of the abscess inside the joint, and because of the abscess collection, it got infected, and because of this infection, there is a degeneration of the joint. All right, the joint got degenerated. There is a complete loss of the joint surfaces, and there will be a narrowing of the joint space. It led to a degenerative arthropathy of that particular joint. Now, that degeneration is referred to as arthritis. That means it is secondary to infection which has resulted in degeneration. But we are not talking about a secondary degeneration. We are talking about the primary infection of the joint. So in a way, this term, this definition, or this heading of this particular condition is a misnomer. So point number one, it is a misnomer. It shouldn't be septic arthritis, because it is not the outcome we are talking about. We are talking about the infection of the joint itself. All right. So it should be pyogenic joint infection. Simply, it should be termed as, or it should be named as pyogenic joint infection, where there is no requirement of coining it as septic arthritis. So you have to understand by the heading itself that it is a misnomer. the condition we are talking about is the joint infection, not the outcome. So it is considered to be a misnomer. So whenever you see the word septic arthritis, means we are talking about the joint infection itself. We are not talking about its complication or its outcome, because septic arthritis means it is the outcome, or the, you can say, the complication of this of the infection of the joint. Next, what is the most common joint which is likely to be affected because of this septic arthritis? You know, the most common joint is the knee joint. Always, knee is the most common joint, and second after knee, it is the hip joint, which is second most common joint to be affected. Beyond this, there are other joints which are likely to be involved, but the frequency of the involvement of knee joint and the hip joint is higher in comparison to the all other joints. Next is most common organism. It remains the same. The most common organism is again Staph aureus. Staphylococcus aureus is the most commonly isolated organism from any of the infective pathology affecting the hip, affecting the bones and joints. And finally, you know, this one line which we have written over here, before we come to this line, that septic arthritis secondary to metaphyseal osteomyelitis, we will be having a discussion on this. But before that, we just try to have a discussion on, you know, in acute osteomyelitis, we have talked about that the most common bones to be affected are the distal femur and proximal tibia. Now, both of them are the composites of the knee joint. All right. The second most common or the most common site to be affected in case of adult osteomyelitis was the vertebrae. But you know, the most common site in case of acute infection was the distal end of femur and proximal end of tibia. Both of them are the component of the knee joint. But it was not the joint which was primarily affected. It was the distal femur and proximal tibia which were primarily affected. So that was acute osteomyelitis. Here we are talking about the septic arthritis. That means acute pyogenic infection of the bones or of the joints. And in case of joint, it is the knee joint which is the most common site to be affected, and the hip joint is the second most common site to be affected. Hope you have understood the difference in between the two. Now, my question is, before we talk about that next line that is being written over here, the question is that imagine if you see, if this is the distal end of the femur and this is proximal end of the tibia. All right, and the primary affection of the distal end of the femur by acute osteomyelitis is the most common site to be affected. Now, the question is that this primary infection can progress to involve the joint, leading to secondary arthritis. Yes or no? All right. So, this is what the question is, that the acute osteomyelitic infection can progress to involve the joint, leading to septic arthritis. If it is possible or not. You know, this secondary septic arthritis is a possibility up to 2 years of age, because beyond 2 years of age, this growth plate acts as a physiological barrier, which will not allow this infection to progress all the way up to the level of joint. All right. So, encroachment of the joint can happen from outside, but not through the metaphyso-epiphyseal connection. So, this is what is being written over here, that the septic arthritis secondary to metaphyseal osteomyelitis, all right, through epiphysis is a possibility up to 2 years of age only, because after 2 years of age, what happens? Beyond 2 years of age, because more than 2 years, this growth plate acts as a physiological barrier. It will act as a physiological barrier. So, this infection from metaphysis to epiphysis and from epiphysis to the joint is possible only up to 2 years of age. So, hopefully you have understood what I am trying to say by this particular line input. Next, the Tom Smith arthritis. You know, this is the kind of a condition or a question which has been asked in 2019 as well as in 2020 examination all India, that what is Tom Smith arthritis? You know, Tom Smith arthritis is actually the joint infection sequelae. That means the outcomes of the joint infection which has happened when the patient was an infant. So, this is what is being written over here, that it is the sequelae or the complication of the hip infection which has happened when the child was infant. That means less than 1 year of age. So, what does it mean, Tom Smith arthritis? Imagine today the patient or the child is 4 years of age. Imagine that the child is 4 years of age and he comes to you with the history of, he comes to you with the complaint of limping, with the pain and abnormality in gait. Now, on detailed history, what you will find that the child suffered from infective arthropathy of the hip joint when he was an infant. So this is what the Tom Smith arthritis is, or so it is always a secondary complication of the hip joint infection which has happened during infancy. Hopefully everything is clear related to this Tom Smith arthritis related definition. Now my question is that why this complication is likely to be permanent. The reason is that, when the child is infant, both head of the femur as well as acetabulum, both of them are cartilaginous. And because the abscess leads to degeneration or destruction of the cartilage, and that destruction of the cartilage is permanent abnormality, all right, which will lead to a permanent deformity. So this is the reason why every time you are presented with the patient who is suffering from the acute pyogenic infection of the joint, the infection has to be drained as early as possible. Not because that it will be deleterious for the human body, but because it will lead to a permanent destruction of that particular joint. Because the cartilages are going to be eaten away by the infection and it will be a permanent damage to the joint. Alright, so this is what the Tom Smith arthritis is. So what is Tom Smith arthritis? It is not the hip joint infection during infancy. No, it is the outcome of the hip joint infection which has happened during infancy when the child was infant. Next is, what is the investigation of choice? Now, obviously, the investigation of choice for locating even the smallest amount of the abscess is the MRI. MRI is considered to be the investigation of choice. But what is the investigation which you have to do in the emergency? Because, majority of the time you get the question related to septic arthritis that what next? What is the next investigation that you will go for? So, instead of pushing the patient to get this MRI done, you have to get the USG done, because most of the time the patient who is suffering from septic arthritis most of the time are children, and you can easily visualize because the bony barriers are lesser. So you can easily visualize this abscess pocket within the joint, and USG will confirm whether this abscess is located inside the joint or outside the joint. All right. So this ultrasonography is always considered to be the next investigation in children in particular, because every time you get a question related to septic arthritis, more are the possibilities that they will give you a age group of children which are more commonly affected. All right. So if we go on a quick revision of what we have talked about in septic arthritis, point number 1, it is a misnomer. You came to know that it is not the complication we are talking, it is the pyogenic infection of the joint we are talking. Organism remains the same, Staph aureus. Most common joint to be affected remains the same, knee joint and the hip joint subsequently. And metaphyseal-epiphyseal septic arthritis means primary metaphyseal infection directly encroaching the joint is a possibility up to 2 years of age. Beyond 2 years of age, it is not possible. All right.